All right, so it is Sunday, August 24th. My mastectomy is tomorrow. Um, I'm freaking out a little bit. Yeah, I am. Um, Intellectually, I know that this is the right decision. Like, there's no question in my mind. Oh, this is the right decision. But my gut is like, don't do this. It's not so much like the femininity part. It did just hit me recently. I'll never have cleavage again. I know that's weird, but for some reason I hadn't thought of that aspect. Um, but it's more just like taking a piece of my body. I'm like, I don't want them to do it, but obviously I do at the same time. So conflicted. I've spent the last couple days cleaning my house, getting everything ready. Um, yeah, so a couple last minute little things to do tonight. And then people are starting to drop off casseroles, which is great, or different types of meals, which is really, really lovely. I had a lot of people asking, so I kind of just put it in the schedule and was like, okay, you've been asking who wants to take what night, so that's really nice. Yeah, I'm really nervous. I don't even know what I'm nervous for. If it's I don't know. I don't know if it's how I'm going to feel afterwards. I don't know if it's recovery. I don't know if it's just tomorrow is going to be a lot of anxiety just getting the radioactive injection, which I've heard hurts, and then the waiting for surgery. So I'm not actually sure even what the biggest thing is I'm scared about, but let's just get this over with. I just want it done at this point. So trying to prepare my daughter, who again is just under 2.5. Lots of talking with her. She's now appeared with goldfish crackers. It's okay, Mom. Just Mommy's just talking. Give me 1 second. Um, yeah, getting her prepared. We're practicing gentle hugs. We're talking about how when I had my port installed there, so she's always called that my boo boo. So we're talking about how I'm gonna have a boo boo on the other side. Anyway, so I'm nervous. I'll probably do another video tonight. We'll see, but that's where I am. So I'll see what I can do for videotaping tomorrow, depending on how my recovery goes. Okay. All right, so this is it. This is surgery morning. It is currently about 7 o'clock, so we're going to leave in a few minutes to get my daughter to daycare. I was really stressed out yesterday and had like a lot of doubts and second, thoughts about the lumpectomy versus mastectomy thing, but really, it's not worth the risk to me. A mastectomy is just the right decision. So, and that's how I've always felt. I think it was just like last minute jitters, but I went over everything again and went over everything with Kelly and was like, am I making the right decision? And I really am. I'm, just nervous about it. So, anyway, off I go. So, I'm just going to do this quickly. So, I had the injection of the radioactive dye into my breast. But apparently that has to sit for a couple hours, so now I'm waiting. So it's going to be about a 3-hour wait for the surgery. I'm going to try to take a nap. I sent Kelly to go get food and coffee since I can't talk to you. I was like, you still should. Anyway, my lovely room here, so I'm just going to lay down and see if I can take it. Hey, so here's a quick video like I did post chemo. I'm doing really okay. I got to the hospital at 7:45 this morning. I had to go to nuclear medicine and get a radioactive tracer injected near my nipple, which sucked. It just did. But that was so that they could trace which lymph nodes flow first from the tumor area so that they could remove those ones for testing. And then went to day surgery, and I had to wait 3 hours just for the tracer to go through. So my surgery wasn't until about 12:45. Walked in myself. Everyone was so lovely. I had a really nice nurse that was like stroking my eyebrow, well, not where my eyebrows were, while I was falling asleep. Everyone was really great. The surgeon who I've met before is great. The anesthesiologist was great. And Kelly was able to stay with me right until I walked down the hall. And yeah, I remember in recovery just really struggling to stay awake. And once they discharged me from there, it was the same thing in the like back in my room. I was like, I can't stay awake. but Kelly drove me home and I came in and went immediately to sleep. I quickly called my mom because I knew she would be nervous. And then I went right to sleep. So I'm going to do my other phone calls tonight. Yeah, but I'm feeling okay. I haven't been given any opioid painkillers, but just a other kind of painkiller that's a non-opioid. So I'm taking that as soon as supper is ready because you take it with food. Thank you to all the people who have brought us food. We are now well stocked, which is great, either from who has offered or the offers that are coming in, which is great. Yeah, so not too much pain right now. I have this like cool mastectomy shirt I got, so it like completely unsteps on both sides, and it has a pocket for my drains. Um, Probably what I'll do is make a little video for those of you that want to see things like my dressing and my drains, but like I'll put it up with warnings so you don't have to watch it. Anyway, yeah, thank you so much to everyone who reached out today. I may or may not get to respond to all of you because, you know, it was a lot. But yeah, thank you. Everyone was great, and the hospital today was great. You know, everyone was really, really lovely. And yeah, I'm gonna go eat. And again, I think I'm feeling way better than I expected to the day of a mastectomy. I was quite worried I wouldn't be up. Kelly said he didn't think he'd see me up today, but I'm doing okay, walking around, and yeah. All right, thanks. Bye. Hi, so it's the morning after surgery. It's Tuesday, August 26th, and I'm feeling pretty good. I slept like crap last night. I'm a side sleeper, and particularly my right side. And they suggest you don't sleep on your left side either. So I'm kind of stuck to my back. I did buy a wedge pillow, which did help, but I just had to change positions about every 2 to 3 hours last night. And twice during the night, I just got up and walked around, tried to kind of stretch my back out a little bit because it hurt. But anyway, this video I wanted to show because there are some people interested in my mastectomy bra, what my dressing currently looks like. There'll be no like incision because it's all covered. But I am going to show my drain that has blood in it. So if you don't want to see that, you should not watch this one. Okay, so I have my mastectomy bra on. So these are, my understanding is the Chalmers Foundation that covers these, which is great. So I just got something from my, like a little card from my surgeon, went down to El Mio, which is the store on York Street, a specialty bra store, and they were so fantastic. So they have regular bras, but they also carry mastectomy bras, the fake boobs, mastectomy swimsuits, and the fake boobs for swimsuits. So anyway, they're so lovely. They made me so comfortable. They were great. Even when I walked in and identified myself, you know, as cancer patient, like they all put on masks right away. Like they were so lovely. So this is what this looks like. So it's just like a regular bra. I'm gonna put this down a tiny bit. Sorry, I'm like still learning to play with my little $5 guy here from the dollar store. So you can adjust these so that it's not too tight. And then this, you can see I just have like gauze everywhere. Very nice. But this just helps keep it like, I expected it to be really tight. And it's not. They, because I was like, are we sure this is tight enough at the store? And they were like, no, this is what we want. We want it to be like light compression, but not like ridiculous, like I think I thought it would be. So now here's the really great part. This is my drain. So I'm gonna have to like hold this. So this is my drain. So there's a little incision there that it comes out of. And so for this guy, he's collecting all the fluid. So right now it's red. So my understanding is it will go from red to pink to yellow. When it goes through like blood, kind of bloody, and then down to just like more lymphatic fluid. So what it is that by putting this drain in, because there's going to be fluid buildup, but you don't want the fluid buildup in here, and your body reabsorbs it so slowly, you don't want it to like pop your incision, obviously, or put pressure on it. So this just drains it out. So far, as you see, I haven't, it's also done by suction, so it's okay if it's up above. That was one of my big things, was like, oh, it has to be below. It's done by suction. So as you can see, the bulb is deflated. When I go to open it, I wash my hands first, obviously, open this little bit, and it'll go pop and open up. Um, and then I just measure it out into a little cup, note how much was in it, um, throw the liquid down the toilet, and then I just squeeze this to get the air out and put the thing back on. So it's a lot easier than I thought it would be. I was really scared about the drains because I thought it would be like so much work, and they're actually fine. They're annoying to sleep with, don't get me wrong. It also has like a little thing on it that I can clip onto things, so I could like clip it onto there, which is really helpful. And again, because it's a suction based, it doesn't have to be lower than the incision. So I did buy a tank top that has drain pockets in it. I didn't wear that to bed last night. I wore it during the day. I was really scared that if I moved around too much, it would bleed. And the whole point of having it is to have something I can wear outside with a drain pocket, and I don't want to get bloody right away. But I have like range of motion. I thought I wouldn't. I was really worried that I wouldn't have a lot of range of motion in my shoulder. I'm not supposed to have it above my head unless it's like brief. Hilariously, the extramural nurse said, unless you're brushing your hair. That was funny. But, you know, I can like put it above for a second. I'm just not supposed to like do that lots because you don't want to strain your drain incision. So again, you can kind of, you know, she said if you have to try to keep things down, which I did, but if you, you know, need it to get something like Kelly. Yeah, so Kelly's just dropping our daughter off at daycare, so I am home alone right now. But I got my coffee mug down and things. But if, let's say, I needed to reach something up, I could briefly, just like being very aware of it. But I was really scared I'd be like this. I think part of it is that mastectomies used to take out all the axillary nodes, lymph nodes. Now they only take on the sentinel nodes because they find that, you know, if there's no, they took 2 or 3, they couldn't quite tell me afterwards because he just couldn't remember. To be honest, the surgeon did pop in. He didn't have his notes with him, and he's like, I can't remember if it's 2 or 3, but he was like, it's no more than 3. Because he was doing several mastectomies that day, so I'm sure he was just like, which one are you? But anyway, they used to take out like 30. So there used to be a lot more complications. Also, I have a lot of people being like, but I remember a mastectomy like 30 years ago, you know, you were in hospital for a week. Well, they used to take the chest wall, like they used to take that muscular layer. They don't anymore because it doesn't lead to any better outcomes unless you're, obviously, if the cancer has invaded the chest wall, then they do. But if it hasn't, it doesn't lead to any better outcomes. So like, why take off that huge piece? So for me, it was just the breast tissue, you know, from here to here. So my nipple's gone, breast tissue's gone, sewed me back up, and up to 3 lymph nodes. So when I first got to the hospital, they put an injection just outside of my areola, so just outside like my nipple area. It hurt, not as bad as I thought. Like I've heard it's like the worst bee sting of your life in a very sensitive area. It really just felt like a needle. It hurt for a second. And Kelly timed it, and it was 13 seconds because he was like, how long is this going to be bad? It was 13 seconds, so it wasn't bad. So I got that, and then you kind of just have to wait for that. So then what it is they essentially inject it directly where your tumor is. So she had like already looked at my MRI results to see where the tumor had been. They put it there, and then what it is that after a couple hours, it goes into the first lymph node. So essentially they're trying to see which lymph nodes go from your breast first, like that lymph fluid. And they take out those because they don't want to take out the wrong ones. For every lymph node they take out, your risk of lymphedema, which is a swelling that once you have it, it's kind of there for life. Like there's not, you know, you can, if it's really low level, they can try to manage it and like get it down a teeny tiny bit. Once it's like, essentially once it's like visible swelling, you're screwed and you're just swollen for life. So that's terrifying, which is part of why they only take 3 lymph nodes. So let's say the scenario is the pathology comes back and all 3 lymph nodes have at least 1 cancerous cell in them. They'll have to go back. But for me, despite the fact I was like, take the whole breast, not just a lumpectomy, because I was worried if you do a lumpectomy and you may have to go back again. For the lymph nodes, the risk of complications is so much greater if you take too many. You know, if they took 10 and then they realized they only actually needed to take 2, you know, that risk of complication is much greater and a lifelong risk. Whereas this, of course, is a lifelong knowing I don't have a breast. But anyway, it just seemed the right decision for me. So that's really it. That's my gory stuff. So I still have the red you can see on my arm. That's just a cleaner. It's not blood. If you've ever had surgery before, you know that there's this like red cleaning goo. I'm sure I'll make another video about everything. Last night I was so like still tired and out of it. So I'm sure I'll make another video later, but I want to make this gory one in case anyone wants to see it. See my little drain buddy. All right, thanks. Bye.